Good morning, physiology friends. Here we go. It's just another manic Monday, a little rain outside the window. Things are going well. Anyhow, here's kind of the plan. We're going to wrap up really kind of lecture stuff. We've covered most of it already, and we'll do a review on immunity. And then we're going to flow back into we're going to do a couple things today. One, we're going to look at inflammation because that has been a key discussion in COVID-19 about the high-grade fevers and how long they've been lasting. And so we want to make that connection. So I have a little packet for you to work on after this short video lecture. And then we will tomorrow just double checking with self and non-self. I was looking back, I can't recall if earlier in the year we did the self versus non-self, but I'll have a little packet on self versus non-self to lead into understanding about autoimmune disorders and stuff too that are doing things. Then Wednesday we'll have our next cooperative quiz. It'll be basically on a specific immunity because we have not quizzed on that. We've only done initial stuff. So Wednesday will be the day we come together for a cooperative quiz. And then Thursday, Friday, we're going to move back into, as we've now talked about, blood and components and lymph and kind of what it does. And we're going to bring lymph, blood, and cardiovascular all together in looking at how the heart operates, etc. And those functions of lymph and leukocytes, and then as things are traveling and what they do in the lymph nodes, and how, for like example with COVID-19, how is that, like you read in that one very difficult article, affect? Why are there people with higher concerns, medical concerns, those that are have heart issues and are taking, as we saw in that article, different heart medications? What about diabetics? What about, certainly immune compromise makes some sense, but anyhow. But let's just do a quick review, and really it's just going over what we said. You have three lines of defense, okay? The first line is really just your skin mucus membrane, the openings, the mucus, the stuff that does not allow pathogens in. But as we can see in kind of this wrap up on a bacterial infection kind of deal, and humoral mediated immunity, certainly things get in. Things get past the first line of defense. It happens, okay? So then you have the second line of defense, which is the phagocytes here, the macrophages, and some of the circulating leukocytes down here that are ready and able to do things, and the killer cells and stuff. So you have that second line of defense of the innate macrophages and everything else that we'll try that are not specific to what's coming in, but just know that it's a pathogen and it's an invader. And then that also works in concert with then our specific immune response, which again, we have a couple. We have the humoral mediated antibody deal, and then we have the cytotoxic T cell response, or the cell-mediated response. And, they all work in concert together. This one kind of shows, here's the overall of a bacteria. You can see, in this case, you had a break in the skin and it was able to come in. But I think the key components in looking at this is, as it came in, certainly one of the things that activated were the complement proteins, those general innate deals that went on. And as you can see, everything shooting off of them. Complement proteins come in, they can act as opsinins and coat the protein and start doing the stuff like that. That also will then help trigger, besides what's coming in, you'll get a trigger of plasma proteins, you'll get a trigger of leukocytes. This all comes from activating the mast cells of an infection, which triggers that chemotaxis, which will trigger the inflammatory response, everything else. Also some histamines, which will increase the permeability of the capillaries so that the plasma proteins and the circulating lymphocytes can come in, okay, and trigger innate actions here that will try and wrap and digest, whether it's the complement proteins acting as opsonins, some of the different plasma proteins, also working as opsonins, the leakiness and the chemotaxis allowing inflammation, letting the leukocytes come in and doing the engulfing. What we do know is that as you engulf then these things, you also get those antigen presenting cells, which then will do a couple things. You will trigger the B lymphocytes in the plasma cells, which will start secreting antibodies. And those antibodies then come in and do what we said. They grab and they hold on until NK cells and stuff come in and kick out the perforins and all that stuff that helps puncture the plasma membrane and make sure that things are destroying the invader. But also notice that as you engulf in the, which we'll see in the next slide, as these macrophages then kick out the antigen presenting sites, that you'll activate T cells, which again, work both, as we've seen before, work both in activating B lymphocytes, and the helper Ts will trigger cytotoxic T cells. And so you get this whole barrage of things trying to take care of that insult. And then certainly as you kind of win the war or whatever, in this case, if you did have a breach of the skin and stuff, then the other stuff that came in and blood clotting and the platelets and everything else would be repairing this area. You would have had macrophages kind of sealing off this area and stuff we've seen. But however it gets in, that's the big coordinated attack, okay? And that's the antibody-related stuff, okay? And that takes time. Here is a big overview, and this is assuming you've had the viral infection before, because you can see virus invades the host and immediately, So this is not the first time. We know the first time similar things would happen, but it would just take longer and things going on. But as you can see then, here we go. Here comes that virus invading. Here comes the macrophages engulfing. Now this one you see the presenting antibodies that are saying, hey, here we go, because this is the second time you've been infected. Okay, there you go. And so they surround, and then they present with the antigen presenting antibodies, which is then your activator, okay? And you can also see that triggers, again, the inflammatory response, the cytokines, the chemotaxis that goes on to activate it. Again, as you get that, you've got interferon action wrapping this thing around and stuff with coats. But again, you get antigen presenting. So part of it is getting cytotoxic T cells going, but part of it over here with the helper cells and stuff. Now the helper cells with that antigen presenting will bind, and that helps identify what it is. So they can activate the cytotoxic T cells, which go in and bind. And again, the perforins and all the other stuff that helps it punch holes in the membrane and destroy it and stuff like that. But also notice that, again, you've activated those B lymphocytes, turn them into plasma cells so they can bring in antibodies, which then come around and do that stuff. And again, that's the second time that you've been infected. The first time you would still have the similar process, but it would take much longer, because you wouldn't have this initially happening here. You'd have stuff going on, but it would have to figure out what's going on. This step would take a whole lot longer in getting the antibodies to come in. Okay. So a couple last things to talk about. There are two types of immunity, passive and active. Passive immunity is where you get immunity from someone else. The biggest, easiest example is mom. While you are a fetus in the womb, all your immunity is coming from mom through that blood exchange and stuff in the placenta. and you keep some of that in a short-term period right after you've been born. Now, in that, one of the things they discuss in that argument between should I breastfeed or should I um, give formula is that connection to breastfeeding still keeps immunity, passive immunity flowing through the mother. So whatever the mother has been exposed to her antibodies to have while you're a fetus, or even some of that, not all of it, some of that immunity through breastfeeding and stuff keeps it. But again, it's a short-term thing. It doesn't last long. It's something that has been triggered through mom. And that's why right now with folks going through pregnancy, the idea or the concern of the COVID-19 and its effect and stuff now. Fetuses don't have the respiratory, they're not breathing, so they don't have that respiratory thing, although that shouldn't say that it doesn't affect the lungs and everything else. It's just they're not breathing through their lungs. That doesn't mean that it won't have implications for their developing lungs. But that's the first, but that's short term. And again, so either the immunity while being in the womb or the immunity of breastfeeding and once born. The other are serums, and these are the immunoglobulins that you can get an immunoglobulin shot and get that same, as you know, the immunoglobulins would plasma proteins would surround and help do the breakdown of stuff or interference and stuff like that. Your other type of immunity is the active, and this is what we talked about. The primary response, the first time you're exposed to a disease, it takes about 2 weeks. In fact, I should change those dates. I mean, there are some that, yes, in a few days. The average time to peak is about 2 weeks. So, that's some old numbers that I forget to change. But if you want to look at the average of every pathogen that came in, you're looking at about 2 weeks. Okay, and that's a lot of time for a pathogen to do its job inside the body and keep producing toxins. But you do get millions of B cells made. They do have to figure out how to make the antibodies to get things going, and before you can get those antibodies binding and then having the cytotoxic T cells and the NK cells and everything come in and do stuff. Okay. The other thing you can do then is, this is the point of getting a vaccination, and this is why they're talking about vaccinations and how long will it take and everything else. Vaccinations, and I had this discussion with my kids this weekend because they were talking about, I need to go get more antibacterial soap to wash my hands and everything else. And it's like, the antibacterial has nothing to do with it. Antibacterial medications like amoxicillin, penicillin, whatever, are for living things. They have no effect on viruses. That's why vaccinations were developed. They are what's called an attenuated pathogen, or basically they've killed the virus, but they inject you with the dead virus so that your body recognizes it as something that is not you, and that triggers that primary response so that you don't get sick. But and that's a myth. Well, I don't get the flu shot because it gives me the flu. No, you got the flu because you got the flu, not because you got the shot. You got the flu because even though you got the shot, you hadn't had the time to make the antibodies, so you got the flu. Not that there have been errors. If you've been reading in your polio thing, at some point they'll tell you that there were errors. There was one batch of errors with, I believe it was polio, where it was not an attenuated virus. They accidentally made a bunch of vaccine with live virus. Oops. And had that going. But anyhow, that's the point, is that it triggers that immune response so that your body believes it has been infected. And so that really you get a fake primary response, which then leads to the secondary response. Okay. And that's when things come in, and that's on that last one we saw. You get invaded. Antibodies have already recognized it. Takes them to, you can get the antibody thing, you can get the helper T cells in there. They already have the background on it. Part of that is why you make B memory cells. So some of those B cells don't make antibodies. They are a file, and how long that lasts in your body from not long, and you need booster shots and things like that, to once infected forever. That's a good question as to why that happens. But then again, your peak time to getting all the antibodies and really triggering that response is just a few days. Okay, so again, that's the whole point of getting the vaccination, is that you fool your body so that if you actually get infected with something that you haven't had before, you are already acting on the secondary response. Now, why does it not always work with flu shots? Because because there's different viruses. The flu is never the same. They watch as flu spreads around the world. They try and put in the vaccine the predominant sources of the influenza virus that is going around to have their response, but it's not, they can be 60% effective, 70%, 40%. It's just if they've got the right strain that they're giving you the vaccination for, or the right combo of strains, and that's sometimes that's not done, and why it's not effective. Anyhow, so that's it, and that's part of the reason why they're talking about it. It'll be a long time before, because you got to figure out the virus and how it operates, and how you're going to do it, and the strains and how it mutates and everything else. So to get an overall vaccination takes some time. And that's what I asked you. I asked you a question about herd immunity last week. This goes back to the herd immunity question, vaccines being tagged, and we'll talk about that this week. Anyhow, that gives us a good wrap up. So after you watch this, download the inflammation packet and start working on it. You don't have to complete it today. There's a number of questions. But it's good to see then how that inflammation response works, because then you can start thinking about high-grade fevers and COVID-19. Anyhow, stay healthy, stay safe, and we will talk to you very soon.